just about finished chapter 14 last time, but I bugged out because I was afraid that we were going too long. Actually, there's only a few slides left. So let's take a quick look at just a couple more definitions and some observations to finish up this chapter. The Centers for Disease Control, or more formally Disease Control and Prevention, is a federal government agency that keeps track of epidemiological disease information and makes recommendations for what to do to protect the public health, which is the overall health of the population in the country. And it's a very important part of the government is to protect people from disease. And we take it for granted. And sometimes we even think, oh, my rights are being violated. But in fact, it's a very important part of our happy lives that we lead, having somebody with a good scientific background and lots of good data coming in all the time, making sure that we are safe from various kinds of diseases and accidents and so forth in our lives. So they publish data regularly about every kind of disease and all kinds of statistics. But what I'd like to do is just do a quick little history of this subject, epidemiology. Epidemiology started with John Snow. He was really the first epidemiologist. And the problem was there was a cholera outbreak in London in the 1940s, late 1940s. Cholera is a very, very severe diarrheal disease. And at that time, all of the fresh water that people had to use in their homes came from pumps in different parts of the city of London, where they could all get in line and carry whatever vessels they had with them and fill them with water and bring it home and use it for their washing and their cooking and everything else. And the problem was that everyone was getting cholera. And John Snow collected data on all the people that got cholera, wherever it was reported, and observed a pattern that showed that most likely one particular pump where water was being pumped out of the ground, out of the aquifer for people to use at home, was contaminated with cholera bacteria, Vibrio cholera. And so they shut off that pump and basically eliminated that problem at that time. So that is, in a nutshell, what epidemiologists do. They collect data and they make observations. They try to figure out patterns. They try to figure out causes of disease, and they figure out what to do about it. Semmelweis was a physician, an Austrian physician who worked in a hospital where there's a very, very high incidence of postpartum infections that led to death. Puerperal fever is an infection that occurs in the period of time after a child is delivered. And a lot of the women that came into that hospital were getting infections and quite a few dying from severe infections after the fact, after they were treated in the hospital. Their babies were delivered in the hospital. And he figured out that something, they didn't know what it was at that time, something was being carried over from either sick patients in other parts of the hospital or from actual cadaver dissections that were taking place in the hospital. And physicians and medical students were involved in those things, and then going straight over to deliver babies in the fertility ward, the maternity clinic. And he figured out that all they needed to do was wash hands in between, and they could he showed they could greatly reduce the mortality rate and the incidence of these infections in the maternity ward. Unfortunately, the medical community was not ready to listen to him, and he was not treated well by the medical community at all. It wasn't until later, after he was basically ostracized, that they went, oh, shoot, he was right. That was what we needed to do. Anyway, sad, sad story. Florence Nightingale was an epidemiologist who, she was a nurse. She was a nurse and a nurse educator, but she also was somebody who took careful notes. And she observed the diseases and the infections and the problems of all of her patients, war veterans that came into the hospital with injuries of all kinds, and figured out that careful sanitation, washing in between all the patients and everything, and keeping everything clean and the patients clean, greatly reduced the incidence of epidemic typhus, which is a disease that's associated with, as we've said before, with large populations such as armies that are forced to live in relatively poor hygiene conditions as they are situated near a battlefront and don't have the niceties of all the washing that we normally do. So she pioneered a lot of the idea of cleanliness as a way to fight disease. So there's a whole bunch more things we could say about that subject. We're going to leave it there this time. I love history, so I'd love to do a little bit more with that sometime. Maybe I will. Maybe I'll post something on the Moodle page. Descriptive epidemiology has to do with collection and analysis of data. That's what um, our good friend Dr. Snow was doing. Where is he? There he is. John Snow was an epidemiologist doing descriptive epidemiology. Analytical epidemiology is a more careful study. Shouldn't say careful, that doesn't sound right. It's a different kind of study where you're comparing two groups to each other in order to see a difference. So that's what Florence Nightingale was doing. She was comparing the incidence of disease among normal people with a disease group and seeing whether she could bring the disease group incidence of disease closer to the normal. And experimental epidemiology, controlled experiments, and that's what Semmelweis was doing. He was comparing the rate of puerperal fever, postpartum infections, in women who were treated by physicians and medical students who did not wash versus ones that did wash, and showed a tremendous drop in the incidence of disease, or possibly the unwashed groups before he instituted the hand washing, and the same groups after or new groups of women, same groups of care providers after the washing institution. So different kinds of epidemiology, but all very important for helping minimize especially nosocomial infections. Case reporting. In order to have good epidemiology, you've got to have data. And so the CDC has created a list of what's called notifiable diseases. And so healthcare workers all over the country are encouraged in some cases and commanded in other cases to provide data whenever there are certain diseases or certain types of problems in healthcare, so that good epidemiological analysis can be done and we know where we stand. It's funny, terminology I think is funny. Notifiable diseases, that sounds so passive. But what that means is that physicians are required to report incidence of certain, the occurrence of certain diseases or the presence of certain pathogens. Morbidity has to do with medical deficits or liabilities associated with a particular disease. Mortality involves or refers to deaths from notifiable diseases. Morbidity rates. Morbidity doesn't necessarily just mean notifiable diseases, but in this case we're talking about specifically in the context of the CDC. But morbidity just means with any kind of diseases. It's what kind of problems, what kind of bodily deficits are occurring as a result of a disease. Mortality, death. Morbidity rate means the number of people affected in relation to the total population, and mortality rate, the number of deaths relative to a population. So here we have the number of reported cases, absolute number of reported cases of Lyme disease every year from 1999 to 2010. You can see that Lyme disease incidence is increasing, or has been, or during this period of time. There's probably some newer data I could have dredged up, but point is, you just get some idea of some epidemiological study, and we want to say, okay, well, how are we doing? We're not doing well. We have an increase in disease. This is probably a particular geographic region. I'm not sure what exactly that is. But then down here we see relative values. We see the rates. So here we have reported cases of Lyme disease per 100,000 people. In this particular case, it's in different months of the year, and you can see what happens in the summertime. This is a vector transmitted disease. The ticks are prevalent and reproducing like crazy in the summertime. A lot of ticks out there, a lot of people getting bitten by ticks, and hence a lot of Lyme disease cases. Here's the tuberculosis cases. Again, rates, tuberculosis rates reported per 100,000 people over a course of a fairly broad span of history. And when this data first was starting to be recorded in 1948, you can see that there's 100 cases of tuberculosis per 100,000 people. There was a big problem with TB at that time. They had all these TB sanitariums out in the country where they would ship people out into the rural settings where they thought that the good air would somehow help them improve health-wise when they had tuberculosis, but it was just a bacterial infection that they had no way to treat early on. Um, Ultimately, antibiotics came along that made it possible to treat, and that's what happened. Antibiotics were instituted that could get rid of the um, Mycobacterium tuberculosis bacteria. Big drop in incidence of the disease or rate of disease. So that wraps up our chapter on epidemiology. As I said, that's kind of a short little bit, and